Hi, this is Dr. Kazemi. Whether you're considering dental implants or have already decided with them for replacement of your missing teeth, it's important to understand how the treatment process works and how your team of dentists collaborate to deliver the treatment that you want. This is a big question and sometimes a confusing process for a lot of patients. So in this video, we're going to review each step of the treatment process, from searching for the right dentists all the way to getting your beautiful and long-lasting teeth. Having the right team of dentists is probably the single most important factor in your implant treatment success and longevity. Basically, you need two types of dentists. First, a restorative dentist who makes the actual teeth, and second, a surgeon who places the dental implants. The placement of dental implants and restoring them are two distinctively different disciplines which takes years to master. This is why for optimal results, it's best to have a team of dentists, a restorative dentist and a surgeon, each doing what they do best. Here are several ways to find the best dentist and surgeon for your dental implant treatment. First, ask your dentist to recommend a surgeon that they know and trust. Second, call a local oral surgeon and ask which restorative dentist they recommend most. Read the reviews on Google, Yelp, or Dr. Google, which are great ways to learn about patients' experiences and recommendations. Ask about the experiences of your friends or family members who may have had dental implant treatments. Learn whether the restorative dentist is a general dentist or a prosthodontist. If a general dentist, ask about their experience and how many implants they have restored. Also learn whether the surgeon is a board-certified oral surgeon or a periodontist, and also their specific training on what they do best. You have to be cautious with dentists who do not work in a team approach and offer to do both the surgery and the restorations all by themselves. Most of them lack the proper training and the knowledge in the surgical aspect, which is necessary for predictable and desirable results. Also be cautious with those offering discount implants and crowns, as the quality of the materials and the care provided may be compromised. Once you have chosen the best team of a surgeon and a restorative dentist, you should schedule for an evaluation or a consultation. During this visit, each doctor will ask about your dental history, your chief complaint, and problems that you have faced, and also your goals. They will examine you to assess the health of your existing teeth and the available bone structure, as well as your bite and cosmetic requirements. This should be a comprehensive examination to make sure nothing is missed that may cause problems later, either during your treatment or after it's completed. Your restorative dentist and surgeon will then obtain necessary diagnostic studies that will help them understand more about your condition. Proper diagnosis is of paramount importance in recommending the right treatment. Diagnostic studies may include a full mouth series of dental x-rays, study models, dental CT scan, or photographs. These studies will provide your dentist with the information about the health of your teeth, the condition of your bite, cosmetic requirements, the amount of existing bone, and the necessity for other possible treatments such as root canal therapy or gum therapy. Next, the restorative dentist and the surgeon will collaborate by sharing their clinical and diagnostic findings and recommendations. This communication is extremely important in designing and recommending the treatment that best meets your needs. They will then design an ideal treatment plan based on your needs, desires, current dental conditions, cosmetic, and functional requirements. For financial reasons, a second, less costly alternative treatment plan may also be designed. Then, at a second appointment, your restorative dentist will present the collaborative treatment plan and review its stages, timeline, and related costs. The surgeon will also provide you with their plan and the related costs. To complete your treatment, you may need teeth extractions, bone grafting, restorative procedures, root canal treatments, or other necessary treatments to meet your goals. You will be presented with a detailed treatment plan that discusses what treatments are needed, who's going to perform them, the number of stages, and the length of time it takes to complete. This is a perfect time to ask questions and get clarity on the recommended treatment, as well as discuss payment options that will make the treatment possible. Depending on its nature, your treatment can take anywhere from 6 months to 2 years. There may be waiting periods between each stage, usually from several weeks to several months, while you heal. Remember, faster is not necessarily better. Teeth in a day or teeth in an hour concepts are mostly marketing tactics and not the reality for most people. In fact, in most patients, we recommend a staged treatment that, while it might take longer, is more predictable in achieving the desired results. Once you have gained clarity on all aspects of your treatment, you are now ready to schedule and begin. The first part of any treatment, known as Phase 1 dentistry, has to do with controlling active dental disease process and stabilization of your dental condition. During this phase, you will have your teeth cleaned, defective fillings replaced, hopeless teeth extracted, and a temporary prosthesis placed for those teeth that might be missing, and also complete any necessary root canal treatments and periodontal therapy. The purpose of Phase 1 dentistry is simply to get you out of pain, resolve any active problems, and get you comfortable, and also your teeth stable. This phase can usually be completed in a relatively short time over several visits. The next part of your treatment, known as Phase 2 dentistry, has to do with restoring any missing bone with bone grafting, replacement of missing teeth with dental implants, cosmetic procedures, orthodontics, and also restoring the implants and other teeth with final crowns, bridges, or overdentures. So let's talk about various procedures that will take place in your second phase of treatment. If you have lost bone due to gum disease, infection, or trauma, bone grafting may be necessary to create the proper foundation for your dental implants. Having adequate bone is not only important for support of the implant, but also for creating teeth that are both cosmetic and hygienic in nature. The type and approach of bone grafting can vary depending on its location, size, number of implants being placed, your bite requirements, and also cosmetic needs. Bone grafting procedures are quite successful and predictable when they are performed by experienced surgeons. Such procedures include sinus lift bone grafting for increasing height of the bone in back of the upper jaw, onlay bone grafting for increasing the width of bone, and extraction site bone grafting to restore any missing bone at the time of tooth extraction. We use a combination of both actual and synthetic bone and other biological materials for bone regeneration. IV sedation is the anesthesia of choice for maximal comfort during such procedures. To make sure that adequate bone is present, a dental CT scan may be recommended, which provides a three-dimensional view of the bone and adjacent structures. This will show us the available bone, the proximity of adjacent nerves and sinuses, and also position of the adjacent teeth, all very important for a safe and successful implant placement. Once it's confirmed that you have adequate bone, then you are ready for placement of the dental implants. The number and location of dental implants depends on the design of your prosthesis, which has already been determined by your team dentist and surgeon. To assure precision implant placement, your dentist should prepare a surgical guide that helps the surgeon position the implants exactly as planned to achieve the desired cosmetic and functional results. In some instances, the surgeon might use the dental CT scan to virtually place the dental implants in a three-dimensional computer model, which is then used to create a surgical guide used to place the implants. In most circumstances, the implants are allowed to heal for about 2 or 3 months before they're ready for restorations. In others, it might be possible to place the implants and provide you with the teeth on the same day. In some instances, it's vital that the implants are temporized for a period of time before placement of the final prostheses. This includes implants in the upper front area of the mouth, also known as the smile zone, and also certain back teeth where a proper bite must be developed. For this, the restorative dentist will take necessary impressions to create a temporary crown, bridge, or prosthesis supported by the implants. This temporary restoration is left in place for about 3 to 4 months, during which it may be modified to improve its cosmetic and functional characteristics until it is just right. This prototype prosthesis provides a lot of information to the doctors and helps them make the final prosthesis that looks great and functions properly for years. In patients where temporization was not required, the dentist can proceed with the final impressions and the delivery of the final prostheses right away. Once the implants have healed, cosmetic requirements have been met, and the patient feels comfortable using the temporary prostheses, the restorative dentist takes the final impressions of the implants and sends them to a laboratory for fabrication of the final prostheses. The lab is given specific instructions regarding the teeth size, shape, and its color. The dentist then removes the temporary prostheses or the healing abutment and inserts the final prostheses and checks it for accuracy and fit. Following delivery of the final prostheses, the dentist will schedule you for several follow-up appointments to check the bite, evaluate your comfort with the new teeth, and also the overall experience. The dentist will then recommend a follow-up care schedule based on your specific needs. This might be once every 3, 4, or 6 months for cleaning and an overall checkup, again depending on the needs of the individual patient. The restorative dentist will then review an effective hygiene and home maintenance program and monitor it closely during follow-up appointments. Lifetime dentistry is no accident. A long-lasting and successful implant treatment and teeth that patients love to smile and eat with require a precise and methodical treatment approach and a skilled team of dentists that collaborate with a similar vision. It's your valuable time and investment, and you deserve nothing less.